Hi Mr. Butler and Mrs. Huxtable. My name is Charlotte, I'm 11 years old and I'm in grade 5. I heard you want to help make Australians healthier. I think that's awesome. But you may have forgotten one or two small things. Maybe I should give you a hint. I looked around on YouTube and here's a few people I think you should listen to.
What kids need to be healthy? Watermelon. Like carrot, cucumber, apples.
Just food. Is that all kids need to be healthy? What else? Anything else?
We need to sleep. Like can cheese? Cheese, that's a good one.
That's food again.
Run around and brush their teeth. And drinking water. And I love green apples and red apples. Me too.
And we're back to food.
Hi, my name's Mia. I'm 16 years old and I was basically born with half a heart. I had my first open heart surgery at 5.5 weeks old.
This photo was the first time I got to hold you in ICU after you'd had your first surgery.
I like to thank all the researchers and all the surgeons and everybody that's not just made an impact in my life, but also others, because what they're doing is so important. And I wouldn't be here today if it wasn't for all the researchers.
I really have always wanted to work with children. So I started off when I was younger, working with children as a youth group leader, and then I became a doctor that only wanted to work with children. But I kind of realised that no matter how much I worked with each individual child, which was fantastic, I really wanted to make a difference to lots of children. And the only way to do that was research, and the only type of research is public health research.
Research is so important, it's so vital. The data that comes out of it, what that means, or how is that going to impact our children as well. If you care about your kids and if you care about the future, families should be able to be a part of something that we know is going to benefit everyone.
What we're working on is ways to use genomics to improve the health of children and adults by better diagnosis, prediction and treatment of disease. I have 3 kids myself, and so of course I have a strong personal interest in trying to make sure that the world that they grow up in is a world that's built to allow them to be happy and healthy.
We know how important data collection is. Our middle daughter, Reggie, was born deaf, and so we were lucky enough that there had been research studies prior to her hearing loss that were able to direct the best method of care for her.
Every day coming into work is really exciting because I get to work with so many smart people and trying to help kids get better.
Not long after Casper was born, we were referred to Professor Rabi and his team at NCRI for Casper's clinical care. We were told about the clinical trial and we thought that it was a great opportunity for him and our family. So Casper's been part of the clinical trial since he was 5 months old. We're seeing increased growth in Casper than what we would have expected. So Casper's really healthy and well.
Half of all adult mental health problems start in childhood. And the research at the Murdoch Children's Research Institute tells us that if we intervene early, as soon as kids start to struggle, we can make a big, big difference to their lives.
Hi again. So what do you think? Are children a priority for Australia's future or not?